Hello, everyone, and welcome to our second session of CME Palooza. I'm Derek Warnick. I'm the other co-producer of CME Palooza, and I want to thank everyone for joining us this morning for what I think is our 14th iteration of CME Palooza, which sounds crazy to think about. But enough of all that. I'm going to be very quick. We have a truly amazing panel today and an amazing session coming up. So at this point, I am going to turn everything over to the fabulous TJ Moore, who for the past few months has been functioning as our quote unquote CME Palooza intern. So TJ is going to kick us off with the introductory slides. And then I'll be back at the end to wrap up. This is TJ's first time doing this, so cut her a little slack when she goes through all of the all the names of the sponsors that she has. It's not an easy job. So anyway, TJ, go ahead and take it away. Oh, hold on one second, TJ. Let me bring up. I forgot I need to bring up the slides. Sorry. There we go. Okay.
Hello. Thank you all. Happy CME Palooza Day. This is Surviving 2020, how COVID-19 and social justice issues impact the health of underrepresented communities. The session is sponsored by Platform Q Health. Our moderator is Angelo Carter, Grant Officer for Global Medical Grants Grant Officer for Global Medical Grants Advisor. Our gold sponsors are Daiichi Sankyo, PER, Academic CME. Our silver sponsors are Peer Audience, Medscape Education, Clinical Care Options, PCE, HME, Helio CME, Projects and Knowledge, Platform Q Health. Our bronze sponsors, PVI, Catalyst, CMEology, ACHL, Vindico, Paradigm, Postgraduate Institute for Medicine, Global Outcome CME, Outcome CE, I apologize, Integrity, Answers in CME, RMEI, Axis, MedIQ, Integritus, Infograph ED, Free CME, Med Learning Group, PCN, Prova Education, Red MedEd, Peer Voice, CME Outfitters. How to ask questions. You can use the free CME text line to send in a question. That's 267-666-0CME or 267-666-0263. And don't forget to tweet your questions using the hashtag CME Palooza. Speaker disclosure. Opinions, discussions, and/or conclusions expressed are those of our panelists and do not represent an endorsement by or a position of their employer, its parent company, or affiliates. And I will go ahead and give this over to our moderator.
Thank you, TJ. So everyone, thank you for the opportunity. We have the pleasure of great expertise and a group who has a passion for this particular type of topic. I think it will allow us to continue the conversation and really benefit our peers in the industry. Today we have with us Lionel Phillips, who is president of Inside Edge Consulting Group. We have Dr. Charles Vega, health science clinical professor at UC Irvine Department of Family Medicine. Also director of UC Irvine Program in Medical Education for the Latino community. And we also have Dr. Charlotte Jones Burton, Vice President of Otsuka Pharmaceutical Company. So thank you all. Thank you. And the pleasure for me to be involved with this has been great. And I feel like I'm going to learn a lot for this kind of virtual fireside chat that we're going to have. So, when I first think about 2020, it's been emotionally exhausting. I know I'm exhausted. It's been a roller coaster type ride, everything from COVID to racial tensions, homeschooling, social distances, masks. Charles, I see you got yours on today, where we all wanted to hit that kind of Control-Alt-Delete button and really just start fresh with 2021. But I do think it's important to talk about 2020 understand and learn from it. So, just to kick it off from a high level perspective, Lionel, any initial thoughts on 2020?
Yes, thank you, Angelo, and thank you everyone at CME Palooza for the opportunity to be part of this important program today. And the answer is yes. I had the pleasure of being in this business for over 30 years. And this is probably the most unique year that I've experienced in healthcare and in pharmaceuticals. And I think it's been really driven by COVID. We certainly understand that. The George Floyd social injustice. And the clients that we have often spoken throughout the year about these issues. And, how do we lean in better to underrepresented communities? And when I say lean in better is what COVID-19 shed a light on is the health disparities, the amount of disease that sits in this population, and how can we do a better job on taking care of the patients that take our medication? I think that has certainly created an opportunity for new thinking about how to better position drugs, products, also education for those of you that do educational programs in on this population. And then the last comment I'll make is it's not normal. It's not as if you can do community education at a local level. You're doing it virtually. And how quickly can we get up to speed and engage our populations on virtual education? So I think that certainly has really been a factor for 2020. And a lot of these things, my hope is that the inflection point that we're realizing today of change will be carried through into 2021 and beyond. So again, it's such a pleasure to be part of this discussion today.
Absolutely, and thank you. I'll pose the same great points, Lionel. Same thing, Charlotte. Any high-level thoughts or feelings of 2020, or anything you want to mention?
Well, thank you, Angelo, for the opportunity and those at CME Palooza to join this esteemed panel. I agree with a lot of what Lionel said. 2020 has been unusual, and thank goodness we are in October, so I've had time to get accustomed to what 2020 has to bring. For me, I think that 2020 has really shined a light on things that we've known have existed. I mean, we've known health disparities have existed for decades. We've known that there have been racial injustices. And what it has done, I believe, has slowed everyone down and put us in a place of where we must look at the truth right before our eyes. And for those of us who are change agents, it has allowed us an opportunity to really rise to the occasion, to propose solutions, to lead during times of uncertainty, and to continue to further the work that we've been doing. So that certainly has been true for myself, and hopefully I can share more about some of the things that I've been doing in this very unusual year.
Thanks, Charlotte. I couldn't agree with you more. I think it's kind of been the elephant in the room when you sit back, and at least, and I know in our industry, it is something that is known with underrepresented communities that are out there, and I do think it is kind of this wake-up call that has been to the forefront. So it definitely gives a voice here. Charles, same thing. Any high-level thoughts in 2020?
Yeah, so my first thought is sorry for the pajamas and the mask, but I'm about to jump into patient care where I might be seeing some COVID-19 patients today. So therefore, we got to safety first. And I just want to say thanks as well for this opportunity to be part of this great panel, this very important discussion. I'm always so impressed with the equanimity and compassion of Lionel and Charlotte. My assessment of 2020 is that it has been awful. It's been an awful year for so many people. It's straight out the gates. And here, my ground view in Santa Ana, California, of course, we're facing the pandemic of COVID-19, which we know disproportionately affects people of color. 80% of my patient panel speaks Spanish. We're one of the largest per capita Spanish-speaking cities in the country here in Santa Ana, and so I see that every day among the folks who are all front line, to this pandemic. But it's also combined with this, the pandemic of economic depression. I knew in February, once this really started, the economy started to tank. The reality of this pandemic was setting in. I knew we'd be getting an influx of folks who lost their jobs, who were getting foreclosed on, who are now homeless, who lost their health insurance, and so that's come, all to be. And so we have those twin pandemics, and then it's set against this really much more endemic setting of systemic racism. And if without that systemic racism, these pandemics would not be as strong. But as Lionel and Charlotte said, this is where these truths about our country are laid bare. And even though we are leading into this, it's just overwhelming. And so it makes us realize and feel a lot more grounded in just how far we have to go.
Thanks, Charles. So I would say, hey, let's just jump right into it. And I think that's a great segue to this particular topic. And I think the term that sticks out to me when I think about everything when looking at this particular topic is health equity. It's a term that I'm seeing a lot more that is coming to the surface a lot more. And so when I looked at the Institute of Medicine's definition of health equity, it means providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. Additionally, the disparities that COVID-19 uncovered as Black and Brown communities have been disproportionately impacted by deaths related to the coronavirus. Charlotte, I know that prompted you to write a paper entitled Improving Health Equity for Black Communities in the Face of Corona Disease 19. Your recent paper noted that Blacks across the country are being infected and dying at rates far in excess of whites, and implicated our historical structural issues, current biases, and shortfalls in the healthcare system. 5 suggested solutions when I was looking at the paper described, which focused on greater inclusion of Blacks in activities such as clinical trials, which I think will be great for us to touch on this subject, encouraging community-based resources, and providing comprehensive racial data on COVID-19 cases. Is that enough? How do we make sure we're all in this together? Charlotte, do you want to start or react to this?
Yeah, so as I mentioned, COVID-19 really brought to light some of the inequities, and thank you for sharing the definition of health equity, but some of the inequities that have existed for over decades. And one of the things that prompted us to write the paper was an article in the New England Journal of Medicine that talked about, how do we have fair allocation of medical resources? And when I read that article, I was enraged, actually, to really see that some of these suggestions would continue to perpetuate the inequities because there was the structural racism was weaved into that perspective piece. And by that, what I mean is the perspective, laid out really things that could be considered guidelines for if you only have 2 vents, who do you select to receive the vent? And it seemed as if it would value the person that didn't have comorbidities or other diseases over the person that did have those. And so we know that there are social determinants of health, and those are where people are born, impact, the food that they eat, the environment, the toxins that are around them, the stressors that they endure, and those things impact health. And where you work also has an impact of that, and how you're educated. So these things are intertwined together. And this prompted us to write the article. As you've mentioned, there are some solutions that are included in the article, and you've stated the ones that we put forth. At that time, a big one was making sure that we get the resources for diagnosing COVID to the communities where we know that they're needed the most. And we still know today that there are not as many testing centers in places where there are Black and brown communities, or they may require that you drive up to them, whereas we know some underserved communities, they don't, that's not a form of transportation that they use, which are cars. So those things are continuing to disadvantage these populations. And we know, as you've mentioned, the statistics for COVID-19, 1 in 1,020 Blacks are dying. 1 in 1,540 Latinas are dying. This is twice the rate for Blacks, twice the rate of deaths from COVID compared to white. So we know the numbers are still astounding. And when you ask the question, is it enough? No, it's not enough. We could be doing much more, and we need a comprehensive approach that's integrated in order for us to move the needle.
Thank you. Charlotte, a question just popped in, more of a reference for the article that you did write. Where could our peers and colleagues find that article?
Maybe what I'll do is, while we're going through the panel, I'll identify where it can be found online, and I can post the link in the chat box.
Beautiful. Perfect. And Derek will get that over so that everyone who's attending can have access to that. I guess just to go on, to add on to that, and one of the topics was about clinical trials as part of the solution. So Lionel, in your experience and some of the work that you've been doing, why is diversity inclusion in clinical trials fundamental in improving health equity among Blacks and Latinos?
Great question, Angelo. So one of the things that we do have to appreciate is that clinical trials in healthcare, specifically pharmaceutical and biotech, is fundamental, right? We think of discovery. We think of phase 1 through 3, and even phase 4 of clinical trials as the structure in which care is established. We also know that when we look at the FDA snapshot and look at the proportion of Black and Latinos that are actually participating in clinical trials, it's extremely low compared to the population size or the incidence of disease. So from the point of discovery, as well as doing the clinical trials, we're not thinking of Black and Latino populations as part of the fundamentals of care. If you don't engage in clinical trials, the translation in the commercialization of a drug, you're not seeing that these populations are represented. And as such, to understand the efficacy and safety as we commercialize, you don't have enough data to look at. So I do believe that as we think of clinical trials, that there's a need to be very intentional with how do we correct that. When you look at a disease like multiple myeloma, and you know that it's around 20% of the cases, but only less than 4% of those patients are actually in clinical trials. How do we correct that? And I think part of that is certainly driving awareness around the gap. And then also, as we work with our colleagues in clinical development, really have the leadership position to enable change. For those of us that are in the space of education, let's spot a light on the opportunity that it serves. You think of the current COVID trials for vaccines, we also see improvement, but not at the point of population or at the point of incidence of disease or incidence of exposure, incidence of risk. So I think 2020 certainly has shed an important light on this. What is exciting is that there is new discussion and there's interest in many pharmaceuticals from the top down on addressing this and and seeing change, which I think is an inflection point in our business, which I'm hoping will continue on into 2021 and beyond.
Thanks, Lionel. And I think that's great to hear that from an industry type of perspective. And I think what we realize is that we can't do it by ourselves, that we need all hands in this together. So Charles, I think as a nice compliment, in looking at community and looking at patients, can you weigh in a little bit on the role academic centers and teaching institutions could play when looking in this space as well?
Right. So I would love to speak to both Charlotte and Lionel's, very cogent, important points. That, I'm a family doctor, so I live in the world of guidelines. And guidelines, we're talking about screening for lung cancer or management of type 2 diabetes. There's a million guidelines that I look to every day. And they're backed by that clinical science. Those big important trials, those are important to me. They're very important to my patients. But they're and overall they're very valuable because they can get that empiric evidence that you need to make good decisions. But if they didn't come from a place where there was a diversity of input, particularly from communities of color, it's not going to be as valid. And so your guidelines are only as good as as what you put into them. Overall, they can definitely reduce implicit bias, which we all have. But we need to get, I think, a greater diversity of key opinion leaders, including people from the community, in those guideline decisions, and certainly in clinical trials as well. And the way to do that is to foster partnerships over time, to foster partnerships where you're working with communities in a close way, so there's an established trust. I also think it's very important, being an educator and working in University of California, my personal mission is to really have our student body, whether they're in medicine or heading into careers in STEM and science, I want them to reflect the communities in which we serve.
Thank you. You know what? Anybody else? Anything else on this particular topic before I ask the next question?
I just want to add one quick thing. So I do other CME programs, and usually when I look out, it's usually for a lot of primary care folks, and I do see a lot of diversity in the audience. So it's really painful to be pointing out, going through the details of a landmark trial and say, so there were 12,000 people entered in this trial. As you can see, the median age was 56 years. The cohort was 97% white. It's tough because for a lot of the practitioners in the audience, these aren't the folks that they're seeing necessarily in their clinics on a routine basis, and it loses validity. It really is a flaw in the study that when it is overwhelmingly a white population. So it's something to think about as well when we're thinking about the dissemination and the impact of these big clinical trials, which I know are a huge effort and in tremendous expense, but still very important. But we can make them a lot more relevant.
Yeah, and this is Charlotte. If I might add, it's not just a flaw in the science or the study. It's a flaw in our system. It's a flaw in the industry, and it's something that needs to be fixed. And the way that we can fix it, and Lionel spoke to this, is by beginning at the discovery phase to think through what disease states are we going to bring this therapy to market for, where is their unmet need, and making sure that we reflect the populations that we know have the disease along the entire process. And I think as industry, that's where we fail to really bring forth medicines for all patients. It's embarrassing, to hear a physician such as Charles, who's taking care of patients, and to look at science and not see his patients reflected in the data that we're bringing forth. So I really think that we have to shine the light on ourselves in this industry and say, yes, we're doing a job. We're bringing forth innovative medicines, and Whippy, yes, that's great. But what are we not doing? And then how do we do it better?
Excellent points. And I think when we sit back and look, that was going to be one of the next questions, was about pharma's role, whether looking internally, looking at our own house, as well as what we reflect externally to the community. One of the questions that just popped in related to this particular topic is there a way by using medical meetings, so whether it's certain congresses or conferences, to present more on the topic of clinical trials and that they need more diversity? Also want to know how our colleagues want to know how they can help and push the needle on our end to do more in this space. So is there any thoughts of what pharma, what medical education companies, academic centers, what we can do more with addressing and having a call to action or a louder voice in this space?
Maybe I can go first because I've just said we need to shine the light on ourselves, and then we can let those who are external really tell us what we should do. You know, one of the things that I've uncovered, and I've been in clinical development and or medical affairs for 14 years in this industry, and in varying roles. But, you know, what I would say is we have to look at what we're doing and see how that is impacting the diversity that happens in our clinical trials. So if you're designing ad board and you look at who attends your ad board and it's all men or all white men, that's an issue. And that's something that you yourself can do to alter what we're talking about today. If you're leading a development team and your KOLs, you're going to the same institutions that are academic, esteemed institutions over and over again, that's something that you can change to impact diversity in clinical trials. If you're writing protocols and that same exclusion criteria keeps being entered in, maybe it's, you know, if they're HIV positive and you haven't questioned if that really matters to your study, that's something that you can do. So when I say we have to look inward, it's in every aspect of our business along the discovery to commercialization, including medical affairs. We have to look at what are we doing to really perpetuate this lack of representation that we see in the science that we're conducting.
I'll just add a few comments to that, those excellent observations. I think medical education firms can include topics around clinical trials as part of the curriculum. Physicians are hungry to understand how can they do a better job on engaging Black and Latino communities. And one of the critical topics to think of is the barriers to clinical trials. You know, why do Blacks and Latinos resist getting into clinical trials? Why is it so important that we activate community leaders, you know, as part of the solution, including community advocacy groups? And what role would they have to better enable a certain degree of trust and confidence so that physicians, healthcare workers of all types can better be able to engage patients as they see them, communities as they see them. I'd also suggest that for those of you that are in the payer space, you know, how can this language and these thoughts be calculated there? When you think of ICER and other points of consideration for the pharmaceutical industry, you know, how can better diversity, starting with discovery and clinical trials, be calculated into how these drugs can be better positioned at the time of commercialization? So there's lots of different things and a lot of different topics, I think, that we are engaged in, but they do not have the focus on this community. And by adding consideration, that can certainly be compelling topics for your sessions.
Yeah, another question just came in, this one specifically for Charles. Have you noticed a difference in the diversity of CME faculty over the years? Has there been any improvement?
Well, that's a great question. And I definitely have seen a shift in the past 6 months or so. and there is more attention being paid to this. As the concept of health equity and race has entered into more and more into the national conversation. There's multiple people who are engaging and really getting it and trying to do something about it. And so I do what Charlotte mentions, and those same presenters from those same esteemed institutions, that is a trap, and something that we should be working to get out of that trap and to diversify our speakers or the folks who are influencers in this area. But I am concerned about momentum, and that right now I do see this movement that has to be carried forward with some real frameworks that can over time really change the game. Because I'm afraid that we might just slip back into complacency when something else comes along. There are these multiple crises, and so it's very easy to get your attention diverted right now. So I'm a strong believer in actually creating programs that will self-perpetuate and work on big problems like this. It's not going to be solved very easily. It's not going to be solved in a few months' time for certain.
Yeah, I mean, I couldn't agree more. It seems like what is the flavor of the month or the topic, and it gets attention, and then we start with it, and then you'll see things start to fade out. And I do think this is an opportunity to really continue this conversation and to do something measurable to make a difference in this area. And hopefully our peers in the industry get behind initiatives such as these to address these particular issues. So hopefully this will hopefully we'll start to see more. One of the things, I'm just going to shift gears a little bit, because Charlotte, you brought up a lot of great points about what we're doing internally and shining the light. And when I was looking at your particular profile, and I know you were the co-founder of Women of Color in Pharma, WOCIP, can you give a little bit of information on this group and the mission and how it came together, as well as respond to recent COVID-19 and racial, social injustice pandemics, and how has WOCIP pivoted? So anything, because I think our colleagues and peers in industry want to see more momentum and see what they can do and how they can be a part and be able to help groups such as this one that you founded.
Yes, thank you. So WOCIP, as we affectionately call Women of Color in Pharma, was started a few years ago by myself and our co-founder, Patricia Cornett. And we started the society to meet the needs of women of color, focused on Black and Latina women in the industry, really to help us empower ourselves to develop so that we can have roles of impact, the roles where decisions could be made that would affect our communities, such as, some of the conversations that we're talking about today. And what we see when looking at the data is not only is there a representation gap when you talk about people of color in general in the industry, but women of color, it's even more severe for Black and Latina women, from entry level all the way through the C-suite. And so we wanted to transform the industry with women of color and be the change agents for some of the things that we're talking about. So as I mentioned, as I started, these issues that we're talking about today are not new. And the inequalities that we see within the industry as it relates to race and gender in the workforce is one of the impetuses for starting Women of Color in Pharma. Fast forward now to 2020, we find ourselves, as we've mentioned, in this very unusual year that has been challenging for so many. While many have lost their lives, more than many, and my respects and condolences go out to anyone who has been impacted by the disease. There's also many more who we know are now in their homes, not only taking care of their work in their homes, but also taking care of their families in their homes. And these will impact women of color in particular, the stressors and the challenges. And so what WOSIP has done this year in particular are two things. One, we have met the needs of our members by bringing forth educational programs about COVID. Remember, in the beginning, there's a lot that we didn't know. There's still a lot that we don't know in terms of the long-term effects. But in the beginning, there was very little that we knew. We knew it was an airborne disease, but we didn't know all the things that we could do to protect ourselves. And there were conflicting messages. Still today, there are conflicting messages. We've really served as this resource to put on virtual programming. Fortunately for us, most of our programming was virtual, so we've really been able to do that. When we saw that there were the murders of George Floyd, Ahmaud Arbery, Breonna Taylor, who was not as called out as the men were, that really brought to the forefront, why is it that there are Black women who can be murdered and we don't even know their names? Their names aren't as readily available. So we had some content around that, and we really talked about, as a Black woman, what's the impact been on you, and how do you feel when names of Black women who have been murdered aren't mentioned, or when you see men like George Floyd, who could be your son or your daughter, your son or your husband. So let's talk about that. So we've had those conversations. The second thing that we've done, and this gets to Charles' point, this is a moment in time where, yes, we have momentum, but if we don't seize the opportunity to really look at the processes, practices, and procedures that have got us to this moment, and how do we alter them, and how do we build new frameworks, the moment will be lost because we will not have created something that's sustainable and actionable. And so what we've done is we created a think tank where we brought together 10 companies, pharmaceutical companies, and we really looked at, through a full day, we had a panel of experts that spoke to them. We really looked at racism and how racism is at play within our industry. And importantly, what things can be done so that we can break down these walls of systemic racism that exist within our industry, and how can we create a new playbook? Gone are the days of writing a check to a community organization only and not having a relationship with that organization. Gone are the days of the leader, taking picture with maybe 2 or 3 people of color in the company. We really want to put forth actions that can be sustained. And so that think tank was the second thing that WOSIP began to focus on. We invited C-suite level executives to that because, again, we need to get at the decision-making level where we can have the sustainable change. We're now headed into our national conference, our annual conference, which is in November 5th through 8th. And we are going to continue these dialogues, talking about things that really matter. How do you be an ally within the industry? How do you form partnerships with public institutions so that we can dismantle the inequities that we see? So those are the things that we've been focused on as an organization this year, and we are ready to partner at the industry level, working with trade associations, as well as working with companies to move forward and create the frameworks that will be sustainable, that will ensure that we have, diverse populations in our clinical trials. As Lionel mentioned, it's the backbone of our business, and also that have access to our medicines. These are the missions of our industry.
And Shirley, I love it. And again, we'll share the resources to our peers so that they can get more information on it. You had mentioned of 10 group pharma companies all coming together, think tanks. Were there any, and again, the conversation can be uncomfortable, it can be difficult sometimes, especially when you get individuals in a room to have that conversation and that voice. Were there any big takeaways, any aha moments that you can share that came out of that, things that maybe individuals didn't realize that they were doing, or how they can contribute? Anything that that you can share?
One of the things that we started the day with was polling, and we asked out the gate, do you know if your organization has development plans for Black women in particular? And people were able to then look at their data. The majority of respondents either didn't know or said that there wasn't an intentional plan. So that continued to go on throughout the day in terms of looking at your own data, recognizing where you're not intentional, and thinking through how intentionality could really help. As I mentioned earlier, when we talk about who's enrolled in our clinical trials, a lot of the reasons why we don't get those populations is because we haven't been intentional. And the intentionality is around our workforce, as well as all of the planning to make sure that we have the right community partners, the right academic partners, the right investigators and KOLs. Those things are all intertwined. So the big aha was we need to be more intentional about these things so that we can do what it is our mission, which is to make sure that we have medicines that help all patients who have chronic diseases succeed. So I really think that was the biggest aha.
And Charles, I know you've done a lot of work in the community. I think there's a lot of times where we've supported educational initiatives where there's these larger global type of initiatives. But I think especially with a lot of these particular issues, those grassroots community type of activities, is there anything you can share with some of the work that you've done across in the Latin community and some of the initiatives or projects that you've worked on or that you would like to share, or learnings?
Yeah, absolutely. Just like all of you, I've also seen those photo ops where it's like, yeah, it's that one day where we're cleaning up a park in the community, and there's some of the C-suite comes down and takes pictures, and then that's the last we hear of it. But I drive by that park every day, and three days later, it's filthy again. So so I think what we need are those sustained efforts. And I think that one of the things that's working here at UCI is the program of medical education for the Latino community. So this is a 5-year training program that creates not only excellent clinicians, but real leaders for poor and disenfranchised Latino communities. We have 123 graduates now after starting the program in 2004. And the graduates who are out of training now, out of residency, out of fellowship, are doing the work they promised to do. They're 85% are working in a county program or a federally qualified health center, and they're seeing majority low-income Latino populations. And that work has really been I think complemented in the past few years and really augmented and lifted by a relatively new program we have here at UCI. And it's called Leadership Education to Advance Diversity for African, Black, and Caribbean Communities, or LEAD ABC. And it's a similar model. You bring in students who are from diverse communities, who are from communities of color, who have a mission, a personal mission to go back there and work on those social determinants of health. And that is a nice framework as we start to blend and generate more momentum. Every year we're bringing in 12 students, 10 students in each program. You really start to create a movement, and our alumni network is strong enough now where they're self-supporting, where they work with each other on projects and they give back to our program as well. So that's I think a strong example of something that's set over time. And one of the things that the students, and then even after they graduate, they are integrated in the community. So we make sure we have programs that give them the opportunity to integrate, and then they are able to follow their passions from there, because there are so many ways to have an impact on health disparities. It really is an incredibly multifaceted issue. Direct medical care is, of course, one way. But I find that our grads are doing so much more, and it really gives me hope for the future that if we can create more programs like this, we can really make a significant impact.
And it'd be great to get some more, information that we can share with those who joined us on the call, because anytime we can get best practices of things that have worked in the community, because when I think about it, trust is a big thing. So building that foundational piece is very important in improving healthcare, especially in underrepresented communities. And Lionel, I know you've done some work as well. Is there any best practices that you've seen with building trust and building that foundation?
Yeah, thank you, Angelo. And Charles, I completely agree with all of your comments around the community. One of the critical things to think of is doing educational programs that actually touch patients directly, as well as their support system, that being their caretakers. And in the environment of COVID is a perfect opportunity to actually do that. Programs that actually reach patients in the community, you can execute through churches. You can also execute through community programs. And what's wonderful is that the community is getting a lot of their information around health and other things by doing just that, by dialing into a Zoom meeting. We all know that church events and other types of activities at every age, people are dialing into on a weekly basis. They're doing prayer meetings, they're doing church sessions, again, through Zoom. So everyone's familiar with the features of Zoom. And they're also becoming very comfortable with getting their information through a virtual platform. So I would encourage those that do educational programs to think about certainly educating physicians through a digital media, but also you can think of how to do that directly with patients as well as their caregivers. And that's a wonderful way to enable trust around care and disseminate important health information.
Yeah. And I guess in continuing the dialogue, I know, Charlotte, you recently spoke at about racism and kidney disease at the recent American Nephrology of Nurses Association conference. What are you currently working on to dismantle racism at work?
Yeah, so as a nephrologist, I'm definitely passionate about helping patients overcome kidney disease. And one of the things that I've been working on at work is really what we're talking about here is looking at the medicines that Otsuka has marketed and understanding, do we have access across all populations that are impacted by the disease. And it's been surprising for me, some of the things that I've learned, but also to understand the company's stance on wanting to ensure that there is access. So we're currently working on ensuring that the medicines that we have, we're looking at our data, seeing who's being treated and really looking at opportunities to make sure that we can educate the community, educate the healthcare providers for some of the kidney diseases that we're studying to make sure that they know how to look for it. Because we know that, as we've talked about, that there are disparities in healthcare. And sometimes in the Black community, kidney disease is thought of, if you have high blood pressure, that's likely the reason why you might have your kidney disease, why your kidneys may be failing, and the clinicians stop there. So how do we educate them that there are other signs that hypertension might be a symptom of something larger and something that could be treatable? So we're working on our plan for 2021. And really thinking through how can we bring in experts who already have relationships with the community, already have relationships with physicians such as Charles, who's a family physician who's in Latin communities, other physicians as well across the United States, to really help educate them and make them aware of how different diseases can masquerade in underserved communities. Again, so that we can ensure that we have equal, going back to the beginning of the hour when we talked about health equity, we have equal recognition for other populations of diseases, and therefore they can get diagnosed and then on the proper treatments.
Thank you. Again, Thank you. All of these are great points. I just saw a question pop up, and I'll throw it out to the group. It will come off as controversial, but we are having a conversation. If somebody doesn't want to speak on it, no need, but I will throw it out there. Question came in: has the current presidential administration made your job harder? So I don't know if anybody wants to touch that or talk about with policies in your job today versus yesterday or tomorrow, what that looks like.
I think I can try to address it, and I'll take it out of the political, or I'll try to take out of the political realm and just look at it from a lens and in terms of what community health and well-being is like. And a big part of that is your mental health and the ability to feel like you're getting ahead, to wake up every day with a sense of purpose. I think going through time in my practice, I can tell you those things really make a huge impact on the overall well-being of an individual and their family and their community. And the fact is that if you are perceived constantly as a threat, if you see people who look like you, who sound like you, who are held against their will, even killed, live, online, how does that not have an impact on that well-being? How does that stress and that accumulated, burden of worry, of anger, of fear, like that adds up, and it leads to worse outcomes. And there's actually good documentation of this and its cumulative effect on people of color. But I think that is one thing that we certainly have together to work towards, no matter what party you're in or what you believe in. I see people coming, towards the issue of race in America from all kinds of different knowledge levels and backgrounds and angles. But I think we should all be able to agree that we can certainly do better and move forward. And no matter who is elected, I think that's an imperative.
Well said. As I'm sitting here looking at the clock, I did want to touch on this, since we did talk about the current state. We talked about 2020. As we look towards the future, what needs to be done, or what are key takeaways through this conversation? Things that you would like to see change, things that you would like to see continued. Are there things that, as colleagues, we should be doing differently as we sit back and move forward in this space? So I'm looking more for that kind of futuristic or forward type thinking. So I don't know who would like to start, if there's any high level things you want to share.
So maybe I'll just take it by saying I think there's a lot of work that needs to be done. Awareness is only one part of it. Acknowledging that there is systemic racism in the work that we're doing, which has been done by many of the leading companies in our industry, as well as at the trade association level. But then we do have to get to, as we've mentioned on this panel, we have to get to really what's at the foundation of it, and make sure that we are developing new ways that will then be impact our business in a way that's sustainable. So I would say, as I look forward to 2021 and even beyond, it's really beginning to put in place new processes and new procedures so that we are able to meet the needs of all individuals that we are developing medicines for. So a lot more work ahead. I think in order to do that work, we have to have the decision makers at the highest level supporting this, making sure that we have the resources, the adequate resources. And sometimes that means that you are assigning people and you're giving them the right authority and the right title within the pharma industry. So from an internal perspective, I think we need to do more of that in order for us to begin to make some of the change that's really needed.
Well said. Lionel, Charles, any thoughts?
I guess what I would add to this discussion is it would be a good idea that everyone on this meeting look at how they run their business or how you are engaged in healthcare. You're the experts. You're in a way, the thought leaders, and you contribute to change. So ask yourself, on this topic, are you being intentional in the way that we can change healthcare for the better? We've already agree that health equity is such a critical part of care, and healthcare disparities is certainly an issue. We agree that the data shows that in Black and Latino populations, there is disproportionate care. So through your function, can you be more intentional and point to things that you're doing to really enable change and improvement of health in our wonderful country?
Excellent. Charles?
I really appreciate the opportunity to be part of such a sage group here, because everything is so well said. I agree. Go in with intention. Go in to this effort with humility and respect for those around you, and do realize that there are a lot of ways to get involved. Maybe you can be directly involved in the community, but maybe your skill set might be, kind of leveraging communication and assets so that they really are directed more towards the community. So, and then think about who you're working around so you can try to multiply and increase that effort eventually exponentially, but through your relationships and your partnerships. And because this is not, while we should all be carrying on a personal mission towards ending racism and towards social justice and greater inclusion, I think that it's only going to go so far unless we really start to connect and make a stronger effort across those frameworks that Charlotte mentioned.
Yeah, I mean, for me, I think everything that everybody said here has been extremely helpful. Have a voice. Are you doing enough out there? Because we all, in our respected positions, have a voice that we could do more. And so it's doing that kind of check to really look at things across. Any other last words or anything else anybody would like to bring up? Because again, for me, this is just the beginning of the conversation. Like, I hope programs like this, that we continue to see more. We continue to have more dialogue with our peers in the industry, in healthcare. As everybody said, as you have momentum with a lot of these different types of topics that you only see die out. So I'm just hoping and, fingers crossed that we continue the conversation. But I do want to just thank all of you for your expertise, everything that you guys have contributed, and to continue to share. I think that's the best thing across the board. So if there are best practices and examples, as well as what organizations are doing, share with your peers and colleagues in the industry in this space, because it's the power of numbers. So again, thank you all.
Thank you. Thank you.
Yeah, just to reiterate what Angela just said, thank you all for participating in this amazing, great session. Lots of positive feedback from those watching. And I do want to comment, I had a couple of resources, one from Charlotte, one from Charles. I'll post those on the website afterwards so everyone can have access to them. And then I'm going to run through our closing slides here really quickly. If you have a moment to take our survey, we would really appreciate it. We don't do registration, but we do appreciate your feedback. It's right on the live page. There's a link towards the bottom you can click on to do the survey. And then lastly, to view the next session, all you have to do is go to the live page. Next session is our 11 a.m. session, is the 5-month plan. Just click on the link and you'll be able to watch the next one. I should also bring TJ on here real quick to say goodbye. Thank you, TJ, for your work as well, and a great job with the intro. We're at 10:59, so I'm going to sign us out. Thank you, everyone. Really appreciate it, and enjoy the next session.